Health Focus is brought to you by National Medical Stores, NMS, passionate about your life. The disruption in provision of health services by the COVID-19 pandemic will be felt for much longer due to the effects on global health systems. The COVID-19 pandemic claimed many health workers and put a huge strain on the global health system and an even greater one on Uganda's already overburdened health system. As recovery starts, health experts advise that it is time to rebuild both the workforce and the health system back better and stronger through private-public partnerships. Ministry of Health has for long engaged in such partnerships, and as Dr. Robert Mutumba explains, some of the essential disrupted services like reproductive health are now being revived due to partnerships. Dr. Mutumba is a principal medical officer in charge of reproductive and child health at the ministry.
We are seeing this marriage working out with the various partners, PSI, PATH. They are really coming in, first of all, to support the commodity supply chain. Many of these are directly contributing to the procurement of these many commodities, and not limited to family planning commodities and supplies. In this regard, Ministry of Health has for the last decade worked with Population Services International Uganda to especially extend the reach of high-quality and reproductive health services to women of reproductive age across the country. Their focus was on private healthcare providers. Dr. Mariam Luyiga is the Senior Technical Advisor at PSI Uganda.
We were looking at improving readiness of private health facilities to offer family planning and other sexual and reproductive health services. And we've done a lot of human resource capacity building to ensure that they can offer high quality services, and also ensuring that they are reporting to the districts and to the national system, so that this data can be utilized by the government to plan for resources.
Dr. Luiga says they worked with 250 private clinics over the 10 years.
But in the past 3 years, we have focused on improving capacity of these private clinics for sustainability.
One of the beneficiaries is Goreti Nancha, who has been practicing midwifery since 1986. After a 7-year stint in a public facility, she decided to start her own clinic in 1996.
They facilitated my facility with the commodities I need, the instruments. Actually, they have been supervising me, because when they give you knowledge and they support you in the events, we go at a bigger space than our catchment.
Minister for Health, Dr. Jane Ruth Acheng, says partnerships have made it possible for them to boost service provision.
It has supported the Ministry of Health in many areas, especially in the areas of infrastructure, but also in the areas of commodities. We benefit from these public-private partnerships in many ways to strengthen our programs, but also ensure that funding is available at any time.
As recovery goes on, Dr. Robert Mutumba says the ever-growing population has triggered them to finding new and innovative ways of service provision.
There is that enhanced focus on capacity building. 2, the Ministry of Health has also adopted the self-care guidelines. Self-care is a new concept, but it came in at a time, I think, when the country needed it most, when we were grappling with the COVID-19 pandemic period.
The country representative of PSI Uganda, Paul Mason, says theirs was a push for a skilled health workforce.
And so we have been helping them by providing training, making sure that they understand what a quality product, a quality service looks like, giving them support supervision, and making sure they have access to the commodities they need. And in many cases, extending the range of products they offer. So it may be things like long-term contraceptive methods like IUDs and implants.
they introduced a voucher system where a client buys a voucher at only 1,000 Ugandan shillings and is able to access what we call MCH programs, that is maternal child health programs at that cost. That is including family planning services.
It gave a chance to these mothers to make a decision on how to give birth, how to plan for their families.
And doing cervical cancer screening, we benefited in our services. A lot of clients come in. We make a difference in the community because not all other facilities, they offer the services we are offering.
Shem Mutaza, who supervises sexual and reproductive health services in Jinja district, says bringing such care and services closer to women will help in mitigating recurrent problems around maternal health.
Much as we could say that we target the women, but the men were as well co-partners with these women, because you cannot use a method of family planning, say for example, in isolation without your spouse knowing. So the men also were part because their spouses were using these methods of family planning, or even in the event that they were having sexually transmitted infections, which was a major focus as well for this particular program, they were able to get treatment.
And as the PSI Uganda 10-year support winds up, Health Minister Dr. Jane Acheng says the public-private policy and law governing the implementation of such programs ensures sustainability.
It is always in such a way that when that public-private partnership ends, government has to continue with the activities that were designed before.
We know that private sector requires a lot of funding, but we've come up with strategies that are linking the private sector to government systems where we feel sustainability can be achieved.
Over the years, pandemics and other natural disasters have proven our imperative need for health workers, not only nationally but globally too. The experience of natural disasters has shown inadequacies such as lack of drugs, personnel and equipment. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.